welcome back to the Oral Health Podcast. Now, today we want to have a little bit of a chat about when we lose teeth. Like, a lot of people do lose teeth in their adult lives, but why it's important to actually replace them, the role that they have in our health, and also what the different options are for getting missing teeth replaced. Because of course, Karen here with me knows a lot more about the dental side than I do, but there is a lot of different routes you can go down, isn't there?
Well, there are three ways of replacing missing teeth. Starting from a very simple denture, whether that be for one or all of your teeth. Bridges, which tend to be for, a couple of teeth, one or two teeth in the same sort of area of the mouth, or dental implants, which you can have anywhere in the mouth, and you can have a number of them, either to support a bridge or a denture. So those are the three ways of replacing missing teeth.
And why is it important that we should be looking to get missing teeth replaced? Is it a big deal to have gaps?
Predominantly, it would be for appearance. So you are more likely to want to replace a tooth if it's at the front of your mouth or in your smile line. However, having back teeth missing can affect the way that you eat and chew. It can affect your digestion because you're not chewing the food small enough. It can restrict the kind of foods that you can eat, because it's very difficult to sort of chew a nice juicy steak if you haven't got teeth that meet at the back for you to be able to grind the food. So it can affect things like that. So it can affect the position of your jaws, cause you sort of like jaw ache if you haven't got many back teeth. So there are cosmetic reasons, but there are also functional reasons for replacing missing teeth.
So, so I guess the practical side is just as important as the appearance side. You don't want to be limited to just eating soft, mushy foods, do you? You want to have that crisp apple.
Absolutely. And I mean, if you had one tooth missing at the back, you're probably not going to lose any function. So you're not really actually pushed into having that replaced, especially if it can't be seen. But when you're getting to the point where you've got no opposing teeth, which means you haven't got a functional bite, because obviously you need teeth that meet each other to be able to bite together. So if you've got all the teeth on the top, but you haven't got any back teeth at the bottom, your top teeth are redundant. So because they've got nothing to bite against. So that would be the point in time where your dentist would probably be looking at advising you to replace the missing teeth you have.
Now let's have a little bit of a chat about the different options in a bit more detail. So if we start with bridges, honestly, because that's the one I know the least about, so I'm just as keen to learn about it as other people, I'm assuming. So what actually is a bridge, if we talk about a dental bridge?
There are a couple of different types of bridges. So a bridge basically is a false tooth that is supported by other teeth in your mouth. So that could range from a front tooth, which could be attached in the mouth by wings at the back of the teeth either side of the gap. That's often called a Maryland bridge or an adhesive bridge. So what it is there's a false tooth with little flat pieces at the side, either side of the tooth, and they stick onto the teeth either side of the gap. Those are great for front teeth or teeth that aren't being used for a lot of chewing. Obviously, you would have to limit the amount of tearing that you did on that tooth, because they can become disattached. So none of your chewing pens, biting nails, ripping sellotape, that kind of thing that we advise you not to do anyway. You wouldn't be able to do that, and you probably would have to eat an apple on the other side. So that kind of bridge is great for missing tooth at the front of the mouth. If you're talking about a missing tooth or missing teeth that are going to be doing more work, you're going to need more retention for those. So what you have to do is crown the teeth either side of the gap and carry the false tooth between it. So obviously that is invasive treatment because you are cutting down the teeth either side of the gap or gaps to make them the right shape to have a crown. I know we've talked about crowns before, so what you're doing is the dentist will drill around the tooth and make it more of a peg shape so that the crown can slot over the top of it. So that is then cemented permanently in position. And a well-fitting bridge would last in the region of probably 15-20 years if it's well looked after. Bridges can be expensive depending on the number of teeth you are attaching it to. Large spans of bridges tend to be more out of favour these days because they are quite invasive and they put a lot of strain on the supporting teeth. So it's really important to discuss this with your dentist because if your teeth are not strong enough to hold an extra tooth, then a bridge may not be for you because you may actually cause more damage to the supporting teeth and mean that you lose them sooner as well. So it is really important to speak to your dentist about your suitability for a bridge, the prognosis of the teeth underneath, and what the costs would be.
That's interesting. I didn't know that they could make the two teeth either side of it, like crown them so that they are then holding a bridge in place. That's really interesting. And I imagine that is quite an invasive treatment because getting a crown just sounds tough in itself.
Yeah. I mean, it means the teeth either side of the gap are doing more work than they were initially designed for. So they do have to be healthy teeth. They do have to be, very strong in the bones. So if your teeth were all wibbly wobbly because of periodontal disease, a bridge isn't for you because they're not going to be strong enough to hold an extra tooth. So that's important that you take the advice of your dentist. I do worry about people perhaps going abroad for treatment because I think, ethically, a dentist may not do it for you here, but you may be able to get it done somewhere where it's
They're not as
slightly
concerned
less.
about ethics, let's say that.
Yeah, yeah. And you don't want to risk the health of your other teeth. So in that situation, you're going to be better off with one of the other two options of replacing your teeth. A bridge is not for everybody.
Yeah, now let's have a little bit more of a chat, as you mentioned, one of the two other options, dentures. I guess more specifically partial dentures. So
Yeah,
you can correct me if I'm wrong, but I'm going to give it a go.
go on then.
The partial denture is just a denture that replaces one or a few missing teeth. You wouldn't have a full denture replaces full set, top or bottom, and a partial is just maybe like three on the side, or like one in the front and one on the side, or like, yeah, that's my
Yeah,
go.
I think the title tends to give it away, doesn't it? Partial or
Yeah, I
full.
took the easy one. I won't lie
Yeah,
to
yeah,
you, but I
yeah.
still got it right.
You did get it right. Yeah, a partial denture can be anything from one tooth. It's still a partial denture if you've only got one tooth in your mouth and you've got a denture to fit around the rest. It is still a partial denture because it isn't full. Um, so yes, it can be quite small because it's replacing one like front tooth to stretching across the mouth to replace teeth either side of the mouth. So on the top jaw, it will have something across the palate to link each side. At the bottom, it will kind of like look like a horseshoe because it goes sort of behind your front teeth. So you can replace as many teeth as you've got missing. So that's the good thing that you could have a partial on the top, partial on the bottom, just to give you that biting power. A partial on the bottom if you've got all the teeth on the top, vice versa. So it's great for that. It might have some clasps on it. So it may be that you just get a bit of flash of metal because you might be able to see the clasp. There are ways of getting around that. There are flexible dentures which flex against the remaining your remaining teeth. So you don't need any clasps on that because they're using your own teeth to sort of brace against. A lot of people find those very comfortable. Um, Majority of dentures are made out of a plastic acrylic, so they're pink. There are dentures that are made of metal, so a chrome cobalt metal is used. So they are quite thin, they're quite sturdy, they're quite robust. Generally used for comfort again, or for patients that have a history of constantly breaking the plastic because their bite's very heavy. Those are held in with metal clasps. Again, you might be able to see those, but your dentist may be able to do something a bit cosmetic if it is near the front. So again, varying in costs. So please get a quote from your dentist so you know exactly what you're getting. So you want a treatment plan and you want the costs involved, so you know exactly what you're going to be getting. Also with a partial denture, it's quite nice to see a design so you know exactly what it's going to look like when you get it. I mean, there are stages of doing denture preparation. So you'd have an initial impression, and then you would have an impression using special trays so that it is purpose made for your mouth, so the impression is much better. Then you'll do a bite stage, so it comes back in wax, so the dentist can register the way that your teeth bite together, the way that your jaws come together. Then you'll go to a try-in stage. So this is the teeth that are going to be used on your denture, set in wax, so that any changes can be made. So we're looking at shape of teeth, we're looking at shade of teeth, we're looking at the bite of the teeth. Everything is okay at that stage, it will go through to finish. So it will then come back and they will be set in the acrylic. May need some adjustment. You may have to go away with it and, if it is rubbing, go and have a little adjustment. Sometimes you have to go back several times to have that done. But it's worth it in the end because you'll get a denture that you can use.
They're such a skilled, they're skilled crafters, the people that make these appliances and
Mhm.
dentures specifically.
Yeah,
And
dental technicians are
they
working
are,
blind
and
essentially.
they, I remember talking to one, and she was telling me it has to look good. If it doesn't look good, people won't wear them, and then it's not doing its purpose. It's like, so they take so much care in making these things for people with missing teeth. I think it's brilliant.
Yeah. I mean, and there's absolutely no point in having a denture that looks perfect if it's uncomfortable. So he's
Hmm.
looking at comfort as well. So it's looking at making something that is, ultimately wearable. I mean, I know people that only wear dentures when they go out, take them out the rest of the time. That's not what they're designed to do because that means they're uncomfortable. Same with full dentures, really. I mean, if you've got no teeth at all, you would have the whole of your dentition replaced with a denture. Now, that can be full upper, full lower. You might have some teeth on your lower jaw, some on your upper jaw. So you might have a partial and a full. Um, so those, does what it says on the tin. It replaces every tooth that you have. So again, set in plastic, fits over the ridge where your teeth originally would have been. Lower full dentures can be slightly more difficult because over time you lose that ridge, so the ridge starts to shrink, and a lower denture can then slide forward. So that's where you see a lot of elderly people who only wear the top one because the bottom one's more trouble than it's worth because it slides out. That can be very difficult, very uncomfortable, not very nice for the patient because you can't keep the denture in your mouth. So this is why we try and keep our teeth for as long as possible. You get patients come in and say, just take all my teeth out, be far easier. No, it won't. It won't. You need to keep them for as long as you possibly can. And this is what dentists do these days. Minimally invasive dentistry means that we do the minimum work to make you dentally fit. So we don't go in organs blazing and go to the end treatment just so that we can kind of prolong it and make sure that people essentially can keep their teeth for life. But if not, there are those ways of replacing it. So that would be a denture. We always say take your denture out at night, keep it in a little bit of water, or if you're soaking it in a thing, don't soak it overnight in that, just put it in for the length of time. So you take your denture out, you clean it with, not with a normal toothbrush, too hard. So you want a denture brush or even a nail brush, a little bit softer. Don't use toothpaste, it's too abrasive. Use something that is designed to clean dentures. So you clean them, rinse them, put them in a bit of water. If you use the tablet form, again, I think sometimes they're 10-15 minutes. Take them out, give them a rinse, put them in some water. I would normally say before you put it back in your mouth in the morning, give it another brush and put it in. Some dentists even say you can use a mild soap to clean them. I think you have to really rinse them really, 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 really well before you put a denture back in your mouth if you've used soap. But there are plenty of denture cleaning pastes that you can use, which will do the job perfectly.
Yeah, it's just important to keep a denture clean as it is to keep your teeth clean, because
Totally,
they're doing the same
totally.
job, really, aren't they?
Yeah, yeah. Staining can build up and that kind of thing if you don't. So it's important. And as I say, leave them out overnight. I always say to patients, it's like going to bed in your shoes and socks. You need to give your mouth a rest like you do the rest of your body. We don't go to bed in our shoes, maybe socks this time of year. But yeah, leave them out if you possibly can. It's much better.
Yeah, 100%. Now, the last option, in my naive knowledge, is probably the most expensive option. But we can also discuss things like implants when it comes to replacing missing teeth, and that might be something to look at if you've got one or two. But I'll be honest, the only thing I really know about implants is the fact that they can run quite high on the bill.
Implants are expensive, cost prohibitive to many, many people who would like them. But it is kind of the way of replacing teeth that most people would prefer if they're able. Like you say, you can replace anything from one tooth to all of your teeth, really. So what it is, it's a titanium screw. This titanium screw is put into the jawbone where the tooth is missing. Then once it's healed, a tooth will be put over the top. So that's simply one tooth. So it would be like having a crown, or a post crown, in fact, but you haven't got any tooth there. So your tooth is replicated by the titanium screw. So once the bone has grown firmly around that implant, it's going to be sturdy in the bone, and you can put the crown over the top. It will then look like you haven't got a missing tooth. You can do that for several teeth. You can use them as a basis for a bridge. So you can put one either end of the gap and carry the teeth in between. It's so flexible in the way that you can design the replacement of the teeth. A lot of people have full dentures over the top. Now they can either be on a kind of Preston system, so you'd put sort of probably 4 implants in, and then the denture clicks onto those implants, which allows you then to take them out to clean them, to clean around the implants, etc. There are other ones where the implants are put in the jawbone, the dentures put over the top, and then they're screwed into position so you don't take them in and out. So that's kind of a permanent fixture in your mouth. So that has revolutionized tooth loss, really. So for people that have been wearing full dentures for a long time, really wanted to get rid of them, implants have probably, you know, made their life so much better. You do have to be careful. Not everybody is suitable. There are ways of doing things. If the bony support isn't quite good enough, You can use artificial bone to shore up the area to make it stronger. If the root's in your upper jaw, quite close to your sinuses, there is a procedure that they can lift your sinuses up to allow space for the implants. So it's really, really complex dentistry we're talking about here. There's a lot of planning that goes into it to try and get the best outcome for the patient. So it is expensive, and I'm well aware. I'm probably talking pie in the sky, but these things are available. Again, a lot of companies overseas offering it. I think we'll probably do a different podcast on dental tourism
Oh, for
and
sure.
the
Yeah.
pros and cons. Again, I would just look at the treatment being offered versus the treatment offered in the UK, and knowing the backing that you've got in the UK should anything go wrong with the treatment. Implants is big business overseas, and they do get a lot of people that obviously want to have implants but want to have them at a more reasonable cost, and that's their audience. And I just worry that we don't have enough information about the systems that they're using, and their treatment plans, etc. So I think it's again one of those buyer beware kind of situations. Do your homework if you're going to do that. If you're going to go overseas, make sure you know exactly what's covered, what's not covered. In this country, with dentistry, any dentistry, every dental professional has to be registered with the General Dental Council. The General Dental Council are there to protect the patient. So you have that backing. So you have the confidence that you know that the person treating you is qualified and registered to treat you, which I think is really, really important. And some things are, I don't know, worth paying more for. Payment plans as well.
That's true. Yeah.
I don't. It doesn't make it any cheaper, but it certainly can sweeten the pill. So certainly ask your dentist about payment plans for any private work that you're having done. You can see how you can spread the cost, which might make it a bit a bit better for you. But implants are ideal for the person who's in a situation where I was talking about the lower denture sliding forward, because you can use implants to anchor that denture so it doesn't move. So yeah, it's I mean, there are three options. I mean, we're talking top, middle, and bottom in terms of costing. So, you have to go whatever suits your purse, really. But, if you've got a good denture, there are millions of people that wear dentures that are perfectly happy with them.
And people that wear dentures that you would never realise that they're
Exactly,
wearing dentures,
exactly.
because, I mean, I say it once, I say it again, the people that make them are so careful and detail orientated. Like some of the photos that you see, they look like they've just taken a picture of someone's mouth, like to the point where some have veins on. That is like, yeah,
Yeah, it's
a lot of
fascinating.
care goes into making things like that for a reason,
Yeah, well, they make the bridges as well, and they would make the prostheses to go over the implants. So very talented people that have a hand in all of those replacement items. So, and they're working on information given to them by the dentist. So that has to be good information as well. So
Whole
yeah,
team working together. It's what we like to see.
we like teamwork, don't we?
And
It's
it's
like
just
me
good
and
to know
you,
as well
Sophie.
sorry?
It's like me and you, Sophie.
Oh, yeah.
The
Yeah,
dream
of
team.
course. But it's just worth, if you have lost a tooth and you're worried about it, then you know that there are some options. Just to mention quickly that If you have an NHS dentist, those options may just be a little bit more limited, purely because they're very invasive and expensive treatments, so they're limited on what they can offer on the NHS. That's not to say that that's bad. It's just
under the NHS, any treatment has to be clinically necessary. So anything that's deemed for a cosmetic reason would not be covered. So there are things in there that wouldn't be covered. So again, you need to speak to your dentist to see what you'd be able to get under the NHS. 9 times out of 10, it will be the denture option.
Don't think that because you've only, out of these 3 options, been offered a denture, that means that it's going to be subpar. Because you'll get the same result at the end of it. You'll get something that means you can live your life eating things normally and looking great. You know, it's just a slightly different mechanism at the end of the day, isn't it?
Being able to smile.
Yeah, being able to smile. And that's a lovely note to end that on. I hope this has been informative. We do lots of different oral health topics on this podcast, so come back for more down the line.